How's it going, everybody? I'm Butch Zemar, a healthcare reform specialist and author. I'm here with Eric Wilson. He's another health insurance expert that's out there in the field, and we thought we'd come together for conversations with the expert related to healthcare or insurance-related matters. How you doing, Eric?
I'm great, Butch.
Yeah,
Beautiful
no,
neighborhood. No, my heat's fixed. My heat was out for a week, so I finally got heat back in the house. So
yeah. Well,
I'm
there's
happy.
heat coming outside, though.
Well, yeah, I won't need it after today, but that's but at least I have to do it next year, I guess.
Spring is here. Well, there could be a cold winter or summer day too. And since we're staying inside these days,
That is
um,
true.
yeah. So we thought we'd come together for a video to talk about some of the things that we see in the marketplace, as well as some claim experiences that people are going through, and then we'll talk about some telemedicine since we're isolated into our house or just isolated from the general public in general, at least in the state of Illinois and across the country as well. I guess there's certain states, even Florida, I guess they started closing down or getting a little harder on it, but other states are involved. So the telemedicine probably will come into play, but I don't think we've seen a whole lot as far as claims or even phone calls related to the coronavirus or anything related to flus, but we're getting I know I'm getting calls based on employer side where there's employees being laid off, but I know some of the claims that people are talking about, especially early on when they didn't know what was going on and there was all these testing that were involved, that some of them of the patients were getting overbilled. But this is an ongoing topic. It's not necessarily related to the coronavirus in general, because billing practices are all over the place with the way they bill. There's no transparency. There's only certain states that require it. I think Florida is actually one of them, but they're rarely even the current presidential administration, the Trump administration, had passed a law about transparency and pricing, but even that hasn't gone anywhere. I haven't seen anything. Have you seen any transparency of pricing coming up, Eric?
I've heard by 2020. I know there are some places that are doing it now. Like I've seen, like in, I don't know if it's Ohio or Pennsylvania. I've seen a few places there, but as I understand it, 2021 that's supposed to be the rules.
Yeah, so we still got some time, but a lot of them don't want to do it. I know
Oh no, they
personally.
definitely don't want to do it because that's the billing is the dirty secret of the medical industry.
Yeah, definitely a dirty secret. I know when my one of my kids had to go to urgent care, and we were delayed based on waiting in the waiting room, but we were there before they closed. While we were in the doctor's office, we did go past the closing hours, but they didn't kick us out. But when the invoice showed up, they actually charged us a $50 after hours fee, even though we didn't ask. We didn't ask to wait in the waiting room. We showed up there in the normal times. We weren't asked to leave and come back at another time. They just saw us with no problems. But then we get charged a $50 fee. But they end up writing it off because it was denied by insurance. So I argued with the billing lady and said, well, it was denied by insurance because it's fraud, because you shouldn't have been billing anyways, that pricing. And they said, well, the major hospital started doing it, so we're doing it. And I'm like, yeah, but you just wrote it off. You don't want to pass it on to me because the insurance company denied it because it's not an authorized claim. And but they're trying to sneak things in, and that's just what the current event is. But they've been doing this for years. How many times you've been in the hospital and there's claims that are, or doctors that are showing up on the invoice that shouldn't have been there to begin with?
Well,
But
many years ago, Butch, I had blood work. I had back surgery. Jeez, I was probably 25 years ago. I had back surgery, and when I got the EOB, I saw blood work on a day I was not there.
mm-hmm.
It was like $1,000 worth of blood work, which is incredibly intense blood work. The only blood work they did for me was, that you go in there, they prick your finger to see what kind of blood you have. That was the only blood work they did, and it was like $1,000 bill that insurance denied, which
Right.
they tried to put it off on me, and I was like, of course I had to fight it, and I won, but it was like, I wasn't even there that day. How can you do blood tests if I'm not even there?
Right, right, and it happens all the time, and some of it's intentional. I would believe, or a lot might be, and then also, and unintentional. So there's mistakes. I always say there's somebody getting paid minimum wage typing those things in on the typewriter or nowadays the computer, for the claims, and some of the claims could be off by one character or one number, and the coding goes incorrectly. Most of the time, the insurance company has an auto feed that they pick up up on some of those, and then they get pushed back to the provider to rebill it. But that doesn't happen all the time. But what would you suggest that are a couple steps that people can take to make sure that they're not being overbilled or have extra fees that are passed on to them that they're not aware of?
Well, unfortunately, medical billing is complicated, but one thing I always tell people is, don't pay a bill from the hospital or from your doctor until you receive the explanation of benefits from the insurance company. Make sure they match up, and most plans have a copay. If it's a $35 copay or whatever it is, you should be able to kind of figure out if it's close to right. If you don't know if it's right, contact your broker and let them look at it. I look at EOBs several times a month for my clients just to make sure it's right. And I had one recently actually where the insurance company made an error. I don't think it was an intentional error, but they short paid it by $2,000 and billed it back to the customer. Now they fixed it as soon as I brought it up. I said, "Oh yeah, we didn't see that. We missed that. Our mistake." And it wasn't intentional. This particular case, I don't think was intentional.
Right.
It's possible. I mean, obviously the client doesn't know.
Yeah. And just crazily, it's crazy that the world we live in, but then also there's while we're going through any type of treatment or testing to figure out things are going on, I know I've seen it. I don't know if you could shed some light on it, but where there's recommended testing that are involved that may not necessarily be needed for that particular thing. So then there's overusage of the healthcare system, and then therefore it costs money, not to the patient, and then of course insurance. But in the end, the patient ends up paying for it in the long run.
Well, and there's two sides of that. But there's the quote unquote free preventative care.
Yeah.
Affordable care, where they're running tests that may or may not be needed. You have the defensive medicine by the doctor because they don't want to get sued, so they may run some extra tests that they probably don't need. And then you have the tests that are not covered by insurance at all. The doctor says, "Well, we should probably run this test too." Okay, but the patient doesn't realize that they're getting a bill for that extra test. And you see that a lot with Medicare. Where there'll be a test not approved by Medicare, and of course Medicare denies it. Of course, the supplement denies it as well, and then a client has another bill for $30 or $40.
Yeah, it happens on a regular basis. I know a visit that I took my own kid to. He had some symptoms going on during a sport activity, and the doctor was dumbfounded by the situation. He wanted 100,000 tests ran, and in some situations, I could see working through that testing to see if we can make some progress, but he wanted it all done. And I said, okay, so we're going to overutilize the system, and I got a high deductible. So we're going to end up paying a whole bunch of money to find out maybe it's isolated to a few things. And so during that discussion, because I challenged the doctor a little bit, that we narrowed it down to certain systems that we would go see specialists for. So like ENT, cardiologists, pulmonologists. And so it isolated to the certain event that was occurring, so that we didn't have all these extra charges and they would end up being nothing. It happens on a regular basis that certain tests are recommended because it makes them feel good, or the extra testing for defensive medicine, just eliminate any possibility of other things going wrong. Yeah. So it's crazy. Go ahead.
Right. No, and you see that too. And sometimes, and there's a handful of medications that end up being like a crutch, whether it be an anxiety medication. You see that a lot, overprescribed anxiety medications, and, ADD medication seems to be overprescribed now.
Yeah.
Not that ADD is not a real thing. I mean, some kids are ADD. Some people do have anxiety, but you see that sometimes that's just like a go-to, because and I don't know if that's just at the request of the parent, request of the doctor. Let's try something. It just seems like there's an awful lot of those medications out there that may or may not be needed.
True, very true. But that also, it leads to another conversation when we talk about overbilling, is the pharmaceutical world. The price gouging that goes on there at the pharmacy level is unreal. We have very limited resources to allow us to purchase outside of our normal path of service, but some people are moving to mail order. But in your case, you're just talking about,
and that's a great thing with prescription coverage. Not to cut you off, sorry, but
that's great.
I had a client a week ago, went to Walgreens to get a medication. They want $400 for the medication. Applied to the deductible, whatnot. she called me. She's upset. I have a discount coupon. My discount card was about $16 for the same medication. Then I pulled a Good RX, and if you went to Meijer with a Good RX, you get it for $11.97. And she was upset. She goes, "Why don't I want to change pharmacies?" I was like, "Well, it's up to you. You can pay $403 at Walgreens, or you can move your prescription over to Meijer, take this Good RX coupon that I just gave you and pay $11.97. It's up to you." And she wasn't real happy because she thought it was, that medication, she should get her medication any place she wants. I was like, "You can get it any place you want. I'm just trying to save you some money. It's up to you." And so ultimately she got it from Meijer. She was pretty mad at me for some reason, but all I was trying to do was help.
They're always mad at us.
Right.
Just the way it goes. Yeah.
Well, how come I didn't know about this Good RX beforehand? I was like, I don't know. It's not an insurance product. I'm just trying to help you.
Yeah. Yeah. And every case is different. There's people nowadays that are seeing the commercials, so they're aware of it. So it's hard to say, like, why should we keep pounding information that maybe they already know? But it is hard to say what would happen, whether it's the situation's the boss, because maybe the pharmacy they're going to already has it cheap and we just don't know it. But and we don't know until they call us. Years ago, there was probably a bigger issue when we would sign up for coverage for certain people, and the prescription drugs would be covered differently because there was a lot more pickiness going on with the insurance companies, and we would switch from one insurance company to another, and to find out their blood pressure medication, it was cheaper to pay cash versus the insurance, and then that was a big scream. But people have gotten used to a little bit of that, but only because they're becoming smarter consumers. You got the Good RX option. Then you also got worldwide mail order that's going on. It started out where you can mail order from Canada, and that was initially taboo. And that has grown since then. And now you can order from New Zealand or India and all kinds of other places outside of this current scare. But these other places, it's the same drug. You order the same drug. It's not modified. They don't put extra stuff in there and fillers and call it a drug. It's the real deal. If you order a brand name drug, you get the brand name drug. They just store it at different places throughout the world for cheaper cost, which I want to segue into, because you brought up before we jumped on the video about telemedicine. I do know there's a number of practices during the climate that we're running into now, where everybody is isolated, that some of these practices have gone to virtual practices. So it could be a phone call, and a lot of things can be done with a phone call. If your kids, has a common cold, outside of today's environment, but as a common cold, you may not want to drag your kid to the doctor's office, expose them to other diseases that are going on, or germs, and then just to get an antibiotic that every other kid's getting prescribed in the block, and you could just get it over the phone. But it could actually go further. But I know a physical therapist client of mine that is doing over teleconference with video, so they could see the patient mimic the therapy work that they're supposed to. So it's technically an at-home procedure, but they're doing a teleconference to kind of set it up. But I don't know what you've seen lately, any changes, or what you've seen in the past when it comes to telemedicine.
Well, I see it's becoming more. You hear people talk about it on the news now, where no one ever talked about it. It was like, I would talk about to my clients. You probably talked about to your clients. You have this extra. Your policy comes with a telemedicine product, or a lot of the associations. Like the National General short-term product comes with a life association membership, and it has telemedicine. And I think Blue Cross has telemedicine now as part of their package. But people don't realize that, because it's like a separate. It's not insurance. It's like on a sidebar. People don't know they have it. So now it's like, bring it up. And if you don't have telemedicine, you can buy telemedicine from any number of companies out there for probably less than $10 a month. And oftentimes, some telemedicines have a copay, some of them have no copay, a lot of them have unlimited access. And like people like you and I don't want to go to the doctor and sit in the doctor's office. I'm busy. If I think I'm sick, let me call it in. You have a sore throat. What pharmacy you want to go to? And, so I think a lot of that stuff is, it's just, retraining your mind on different ways to think of things.
Yeah.
Different's not bad. It's just, it's different.
Hmm. Yeah, for sure. But I think in the current climate that we're running into, it's forcing practices and people in general to start adapting to new things, such as technology driven, the video conference. I know even major hospitals in the area have been adopting for years. There was technology glitches in the beginning, but it's definitely moved into the right direction in a lot of ways, especially because people are just so busy and they don't want to take time out of their day, because I think it's goofy that employees will have to take off a whole day's of work to go to the doctor and spend half a day in the waiting room just to get seen, where a lot of that can be minimized in the waiting time, the travel time, and whatnot. But I don't know if you have anything else to add to that.
No, it's just telemedicine, video conferencing. Just whether companies or even your local physicians probably know it too now. But
Yeah.
it's just something just something people be aware of, that you might even have a free product with your current insurance. You
Hmm.
not even realize it.
Yeah, yeah, it's out there for sure. It may even be part of, like you said, the current insurance or other programs you may have in the household that you may not even be aware of. So definitely utilize that as we move forward. It actually, when we combine the telemedicine and the conversation with the claims over claims, you have a lot more control of the claims. I believe at that point in time, because I think those calls are usually generally reduced because you're not physically present, but you actually know who was on the call, who wasn't, who was evaluating, who was there. But hopefully it changes some direction with the claim service as well.
Great.
So yeah, so I appreciate the call. It was just the conversation with health insurance professionals in the field. Maybe some topics relate to you. Maybe there's some advice that you picked up from this, and that'd be a great thing. So I appreciate your time, Eric, and hopefully we'll be doing more of these so we can provide more value during this time that we're all isolated, and sharing the information to help them better with claims as they move forward, whether they have the virus or they don't, but just claims going forward in general.
I agree, Butch. Thank you.
Hey,
Good
thank
time.
you. All right.